There are a couple of things that we can do. Some of them are old-fashioned and some of them are very new-fashioned. Depending on the severity of the disease and depending on the severity of the patient, some of them are just old-fashioned. Stay hydrated, decongestants, acetaminophen or other anti-inflammatories for fever, quarantining, staying away from uninfected people. Those are probably the majority of what most people do, because as we know, COVID is in most people a mild to moderate respiratory infection, not completely different than a flu or a bad cold, but it's those other people that we all know so much about that we're worried about. Now, there is a second group of things that we can do that are brand new. There are monoclonal antibody infusions that we can do for folks that have done a really good job of keeping folks out of the hospital. We give those infusions to a lot more people than we used to. You call the COVID hotline, you get set up for the infusion, and you come to our infusion center, which is just downstairs here, and we give you basically the artificial version of what your body would have made if you had been vaccinated, or the antibodies that your body made when you were vaccinated, because unfortunately we still have a few people that do get a breakthrough infection after they're vaccinated. We're giving those people the monoclonal antibodies too, even though they typically have a milder disease, because we have such great access to that treatment that we're trying to use it a lot. It has kept people out of the hospital, we believe, but it is an ordeal. You have to come here and you have to get an IV and you have to sit there until it goes in, and there is a chance of reaction, although it's been very rare. Here at Ozarks Healthcare, we've infused hundreds of people, and the safety has been very clear. That monoclonal antibody infusion is probably the major effective treatment for COVID that we have in an outpatient setting. In the inpatient setting, we have a lot of other things that we can do that are medicines, and I would defer to a hospitalist or an infectious disease inpatient specialist to tell you all about those. But on the outpatient setting, the major medicine that we have right now is monoclonal antibody. Obviously, there's been a lot of bad information about home remedies and other remedies for COVID that we can do as an outpatient. Those are all either in study. I'm not particularly optimistic that they're going to turn out, namely ivermectin. And then the other ones are vitamins and vitamin C and vitamin D. Those things aren't harmful. Obviously, they're over-the-counter vitamins, but I wouldn't hang your hat on that to keep you safe. If you feel like you're at risk for being sick from COVID, or if you feel like you're getting sick from COVID, there is a window for that monoclonal antibody. So we want you to call us sooner than later, and we'll evaluate you and see if you're a good candidate for it.